You just failed a big test and are pretty bummed out about it. Or you're going through a bad breakup and feeling pretty down. We've all been there. In day to day life, everyone experiences ups and downs every now and then. Eventually, time passes on and our mood becomes better and we become ourselves again. Unlike the normal population, individuals living with bipolar disorder cycle through extreme mood swings that cause disruption to daily life. With bipolar disorder, you don't just feel down in the dumps. Your depressive state may lead to suicidal thoughts that change over to feelings of euphoria and endless energy. These extreme mood swings can occur more frequently, such as every week, or show up more sporadically, maybe just twice a year. The depressive and manic phases can last for a few weeks to months. There's also no defined pattern to mood swings. One does not always occur before the other, and the length of time you are in one state or another varies as well. The DSM-5 recognizes three forms of bipolar disorder: bipolar 1, bipolar 2, and cyclothymia. Manic symptoms are the defining feature of each of these disorders. The bipolar disorders are differentiated by how severe and long-lasting the manic symptoms are. These disorders are labeled bipolar because most people who experience mania will also experience depression during their lifetime. Mania and depression are considered opposite poles. An episode of depression is not required for a diagnosis of bipolar 1, but it is required for a diagnosis of bipolar 2. Mania is a state of intense elation or irritability accompanied by other symptoms seen in the DSM-5 diagnostic criteria. During manic episodes, people will act and think in ways that are highly unusual compared to their typical selves. They may become louder and make an incessant stream of remarks, sometimes full of puns, jokes, rhymes, and interjections about nearby stimuli that have attracted their attention. They may be difficult to interrupt and may shift rapidly from topic to topic, reflecting an underlying flight of ideas. During mania, people may become sociable to the point of intrusiveness. They can also become excessively self-confident. Unfortunately, they can be oblivious to the potentially disastrous consequences of their behavior, which can include imprudent sexual activities, overspending, and reckless driving. They may stop sleeping but stay incredibly energetic. Attempts by others to curb such excesses can quickly bring anger and even rage. Mania usually comes on suddenly over a period of a day or two. The DSM-5 also includes criteria for hypomania. Hypomania means under or less extreme than mania. Although mania involves significant impairment, hypomania does not. Rather, hypomania involves a change in functioning that does not cause serious problems. The person with hypomania may feel more social, flirtatious, energized, and productive. Bipolar 1 disorder in the DSM-5 includes a single episode of mania during the course of a person's life. Note then that a person who is diagnosed with bipolar 1 disorder may or may not be experiencing current symptoms of mania. In fact, even someone who experienced only 1 week of mania uh, years ago is still diagnosed with bipolar 1 disorder. Even more than episodes of major depressive disorder, bipolar episodes tend to reoccur. More than half of people with bipolar 1 disorder experience 4 or more episodes. The DSM-5 also includes bipolar 2 disorder. To be diagnosed with bipolar 2 disorder, a person must have experienced at least one major depressive episode and at least one episode of hypomania. Cyclothymic disorder, also called cyclothymia, is a second chronic mood disorder. As with the diagnosis of persistent depressive disorder that we mentioned earlier, the DSM-5 criteria required that the symptoms be present for at least 2 years among adults. In cyclothymic disorder, the person has frequent but mild symptoms of depression alternating with mild symptoms of mania. Although the symptoms do not reach the severity of full-blown hypomanic or depressive episodes, people with the disorder and those close to them typically notice the ups and downs. During the lows, a person may be sad, feel inadequate, withdraw from people, and sleep for 10 hours a night. During the highs, a person may be boisterous, overly confident, socially uninhibited, and gregarious, and need little sleep.
It's important to note that bipolar disorders are diagnosed when assessment confirms the presence of hypomanic or manic symptoms. Some other considerations are the frequency of mood states and the severity of depressive and hypomanic manic symptoms. And I'll show you some graphs in a few moments to help you better understand this. The key to diagnosing the type of bipolar disorder is to pay attention to the range of mood symptoms. The widest range occurs with bipolar 1. There is at least one manic episode with or without a history of major depression. In bipolar 2, there's at least one major depressive episode and at least one hypomanic episode. In cyclothymic disorder, there are milder hypomanic symptoms, consistently interdispersed with milder depressive moods for at least 2 years, and the symptoms do not meet the DSM-5 criteria for a hypomanic or depressive episode. Now, I've provided some graphs in this lecture of hypothetical cases which show mood changes over time. First, we'll look at bipolar 1. Remember, a manic episode is required. Depressive episodes are common but not required to make the diagnosis. Not everyone with bipolar 1 experiences depressive episodes. But feel free to stop this presentation at any time if you want to study these graphs more closely. Now here's a graph of what the mood changes over time for bipolar 2 look like. Bipolar 2 requires a major depressive episode and a hypomanic episode. The main distinction between bipolar 1 and bipolar 2 is the severity of symptoms during the elevated or energized episode. And finally, here's a graph that shows what cyclothymic disorder looks like. Cyclothymic disorder involves impairment in functioning from milder changes in mood. Milder hypomanic symptoms consistently interdispersed with milder depressed moods for at least 2 years. With cyclothymia, the person does not meet the criteria for a hypomanic or manic episode or the criteria for a depressive episode. Clinicians will add specifiers to help describe bipolar disorder. One is with mixed features. There are 3 or more symptoms of hypomania or mania or depression occurring during an episode from the opposite pole. It's also called a mixed episode. Now, if you're like me, you're a visual learner, so I'm going to put a graph on top just for a second to show you. You can see there are both depressive and manic symptoms occurring at the same time during the course of this person's disorder. This pattern usually requires more intensive treatment, and you may see emotional lability, which refers to unstable and rapidly changing emotions and mood. Another specifier is rapid cycling, where there are 4 or more episodes per year. This increases the chances that the disorder will be chronic and the symptoms more severe. The treatment for bipolar disorders usually involves lithium, which is considered the most effective medication for those who respond to its effects. Anticonvulsant drugs are also being used, and antidepressants or antipsychotics may be added to deal with either depressive symptoms or psychosis, but they can, the antidepressants that is, may exacerbate or make worse the manic symptoms. Failure to take medication is a major issue because of the side effects, which can be hand tremors, increased thirst, diarrhea, drowsiness, hair loss, and weight gain. Regular blood work is also needed when someone is taking lithium to be sure the lithium level is in the therapeutic range.
Bipolar 1 disorder occurs much less frequently than major depressive disorder. In an epidemiological study that involved diagnostic interviews with over 61,000 people across 11 countries, about 6 out of 1,000, or 0.6% of people, met the criteria for bipolar 1 disorder. Rates of bipolar disorder appear to be higher in the United States than in other countries that have been studied. It's hard to interpret these particular findings regarding the relatively high prevalence of bipolar disorder in the United States. In one study, researchers asked psychiatrists from the United States, India, and the United Kingdom to watch the same videotaped interviews and then rate the severity of manic symptoms. Psychiatrists from the United States and from India tended to see symptoms as more severe than did those from the United Kingdom. Culture may shape tendencies to label behaviors as manic symptoms. More than half of those with bipolar spectrum disorders report onset before age 25. But these conditions are being seen with increasing frequency among children and adolescents. Bipolar disorders occur equally often in men and women, but women experience more episodes of depression than do men. About 2/3 of people diagnosed with bipolar disorder meet diagnostic criteria for a comorbid anxiety disorder, and more than 1/3 report a history of substance abuse. Bipolar 1 disorder is among the most severe forms of mental illnesses. 1/3 of people remain unemployed a full year after hospitalization for mania. Suicide rates are high for both bipolar 1 and bipolar 2 disorders. 1 in every 4 persons with bipolar 1 disorder and 1 in every 5 of those with bipolar 2 disorder report a history of suicide attempts. People with bipolar disorders are at high risk for a range of other medical conditions, including cardiovascular disease, diabetes, obesity, and thyroid disease. Not only are medical problems present, they are often quite severe. People who have been hospitalized for bipolar 1 disorder are twice as likely to die from medical illnesses in a given year as are people without mood disorders. These sad consequences of bipolar disorders are not offset by evidence that hypomania is associated with creativity and achievement. People with cyclothymia are at elevated risk for developing episodes of mania and major depression. Even if full-blown mania episodes do not occur, the chronicity of cyclothymic symptoms takes a toll.